My name is Trish Murphy. I'm with the Orlando Medical News, and I'm here today with Dr. Koury with the Radiology Specialists of Florida, who is one of the largest diagnostic and intervention subspecialized radiology in the nation. Dr. Koury, I'm going to start with a fairly easy, kind of obvious question, but I think it's important to ask. What exactly is a heart attack?
A heart attack is when your heart muscle is deprived of the oxygen and nutrient-rich blood flow. The most common way that happens is through a process called atherosclerosis, where the coronary arteries, which supply your heart muscle with blood, become progressively narrowed by the buildup of plaque, which consists of fat and cholesterol and other inflammatory markers. Once that plaque breaks off, a blood clot forms around that plaque, and when that happens, that blood clot blocks the flow of blood through the coronary arteries, and you experience a heart attack.
Is it always plaque that blocks that? Is there anything else that happens to the heart that we classify as a heart attack?
Yeah, other issues can happen in which you would have a heart attack as well that are not necessarily due to atherosclerosis, such as coronary artery spasm. And that can happen in extreme situations, such as with extreme emotional stress or with extreme cold. And then there are other less common but other issues as well, such as anomalies within your coronary vasculature that can cause heart attacks as well.
Oh, I see. Okay, great. Thank you very much. Talk to us a little bit about some of the symptoms of a heart attack. What do we need to be paying attention to?
The most common symptom of a heart attack is chest pain or chest discomfort. Usually that chest pain or discomfort can be mild, or it can become more severe depending on when in the heart attack that you're experiencing it. It can be vague. Usually it's in the central chest, and it can be a pressure or a fullness type of squeezing sensation. Some people describe it as an elephant laying on their chest.
Okay.
But there are many other symptoms as well, such as shortness of breath with or without chest pain. You can have nausea, lightheadedness, sweating, or you can have pain in your upper body, such as pain in your stomach area, pain in your jaw, your neck, back, or upper arms. And another thing that's good to note is that women, while they do experience chest pain as well, they can have some of the more atypical signs of chest pain when they're having a heart attack, such as shortness of breath, nausea, and lightheadedness.
So how closely do you work with cardiologists and physicians to help treat patients with heart disease or heart attacks?
Very often what we see is patients who are referred for coronary CT or cardiac MRI for atypical symptoms. If they have low to intermediate risk and the cardiologist thinks something is a little off, they'll get a coronary CT and we'll tell them whether the atypical symptoms are related to coronary artery disease, or if in some cases we can see if there's another cause.
Okay, great. So what are some of the key preventative measures to prevent heart disease?
Eating healthy, nutrient-rich foods, vegetables, low-fat, low-cholesterol foods, exercise, moderate to vigorous activity, 2.5 hours of exercise a week, moderate to vigorous cardiovascular exercise a week, lifting weights, abstaining from smoking or excessive drinking, things like that.
Excellent. Now, I've always wondered, so we've all heard these horror stories of someone who leads a very healthy life. They do all the right things. They eat the right things. They keep their stress down. They exercise. They're basically athletes. Yet, out of the blue, they'll seemingly drop dead of a heart attack, and everybody is flabbergasted. In those cases, what are some of the possible factors or reasons for that event?
Well, the most common cause for a heart attack is atherosclerosis and coronary artery disease. And in some cases, people may have a mild chest discomfort and they may just dismiss it as something that they didn't recognize as being related to a heart attack. If you don't have those kind of symptoms, there are other causes for a heart attack, such as a coronary artery spasm, which can happen abruptly, and that can happen in situations of extreme extreme stress or in situations where you're experiencing extreme cold, for example. Other times that can happen, a coronary artery spasm can happen if you're taking illicit drugs such as cocaine.
Okay. What does the future of diagnosing heart disease and treating heart attacks look like?
Well, the future is now. We have technological advancements that aid in capturing preclinical disease that hasn't manifested with clinical symptoms yet. We have, especially at the Radiology Specialists of Florida, we offer subspecialized reads, which means that the people who are interpreting the imaging are people who are specifically trained to read those studies. So we offer a standardized approach that the referring clinician will understand and be able to act on. So we can aid in the prevention, the earlier prevention of heart attacks.
That's excellent. So it sounds like you guys are kind of able to detect that long before somebody has a heart attack, before that's really an issue, and start treating that now.
Absolutely.
Wonderful. One more question. If someone's concerned about, whether they're developing heart disease or not, what's the first step they should be taking?
I would say the first step is to meet with your referring clinician or healthcare provider and assess your risk for heart disease, and then take an inventory of yourself and see if you meet any of those risk factors, and do what you can to try to improve or live a heart-healthy lifestyle with eating healthy, exercising, and abstaining for smoking and not excessive drinking.
Thank you, Dr. Koury, for your time today. This was very helpful. And thank you, viewers and listeners. Remember, Radiology Specialists of Florida are one of the largest subspecialized radiologists in the country, with 24-hour accessibility and high image quality. So trust them with your heart.